Unraveling the powerful partnership between vitamin D3 and K2, how they regulate calcium and safeguard your heart. When it comes to maintaining strong bones and a healthy heart, few nutrient combinations are as intriguing and vital as vitamin D3 and vitamin K2 working in tandem. But here's where it gets controversial or perhaps overlooked. Their joint influence on calcium management is complex, yet crucial. Many people miss the nuanced way these vitamins coordinate, potentially impacting everything from bone density to arterial health. Understanding vitamin D3's role in calcium absorption. Vitamin D3 is well known for its role in absorbing calcium and phosphate from our digestive system, which boosts the mineral levels in our bloodstream. This process is essential for bone formation because osteoblasts, the cells responsible for building bone, depend heavily on these minerals. Nonetheless, high doses over extended periods, especially when combined with excess calcium supplements, may lead to calcium accumulating where it shouldn't, like in the arteries, raising concerns about risks like kidney stones or even cardiovascular issues. Indeed, research published in the International Journal of Endocrinology highlights that calcium regulation hinges on the coordinated efforts of both vitamins. The critical function of vitamin K2. Enter vitamin K2, often less talked about but equally critical. Its primary job is to activate specific proteins, namely osteocalcin in bones and matrix-GLAR protein in blood vessels, through a process called carboxylation, which essentially switches on their activity. Once active, osteocalcin ensures calcium is properly incorporated into the bone matrix, strengthening our skeletal structure. Meanwhile, matrix-GLAR protein acts like a vigilant traffic controller, keeping calcium out of arteries and other soft tissues where it could cause harm. In simple terms, K2 helps direct the highway of calcium, guiding it to where it's needed most and preventing dangerous deposits elsewhere. Scientific evidence supporting the combo of D3 and K2. Numerous studies focusing on postmenopausal women and osteoporosis patients show that supplementing with vitamin K2 alongside D3 and calcium results in better bone density improvements than vitamin D alone. This synergy is supported by research indicating that while vitamin D promotes calcium absorption and activates genes for bone growth, vitamin K2 ensures calcium is correctly mineralized into bones and not misguided into arteries. Additionally, early cardiovascular research suggests that the combination might slow the progression of arterial calcification, though results are still mixed, and longer studies are required to draw definitive conclusions. What about heart health? One point of debate that sparks controversy. Since vitamin D3 increases circulating calcium levels, some experts worry that taking high doses without adequate K2 might inadvertently promote arterial calcification over time. Studies on vitamin K2, especially in the -7 Müllerian quartile form, look promising as they activate matrix-GLAR protein in vessel walls, potentially reducing vascular calcium buildup. Meta-analyses suggest a modest slowing in the progression of coronary artery calcification, but whether this directly translates into fewer heart attacks or lower mortality remains an active area of research, and a topic worth discussing. Guidelines for safe and effective supplementation. For most, recommended doses hover between 800 IU of vitamin D3, roughly 20 to 50 micrograms, and 90 to 200 micrograms of vitamin K2 daily. However, more isn't always better. Overuse of high-dose vitamin D can lead to toxicity, such as hypercalcemia, and K2 supplements might interfere with blood thinners like warfarin. Therefore, it's advisable to test your vitamin D levels and consult with a healthcare professional before starting any combined supplement regimen. This approach ensures safety, personalized dosing, and optimal health benefits. A closing thought. The potential of D3 and K2 working synergistically to manage calcium and protect our arteries is both promising and complicated. As research evolves, it's essential to question, are we underestimating their combined power in preventative health? Or might over-supplementation cause unintended harm? We invite you to share your thoughts. Do you believe this duo could revolutionize how we approach bone and heart health? Let us know in the comments. Your opinion could spark the next big discussion.